Hello, my name is Jacques Lignes. I'm a resident family doctor in Canada, and I've made this video to tell you all how to use Anki to learn dermoscopy. I'm going to start by explaining very briefly what Anki is, and then I'm going to talk about why you should use Anki to learn dermoscopy, and lastly, exactly how to use Anki to learn dermoscopy step by step. But to start, to explain what Anki is, very simply put, it's a digital flashcard software that integrates two of the most powerful strategies for learning and memorizing any material, and that is active recall and spaced repetition. Active recall is simply the strategy of quizzing yourself to need to actively draw the information you're trying to learn out of your brain from scratch, instead of, for example, passively reading a textbook and thinking that you're fluent in the material, but whenever you're actually confronted with the material, you can't actually draw it up from your memory. It's been shown in many studies that active recall is the most effective method of memorizing any material and committing it to long-term memory. What spaced repetition is being confronted with that same information you're trying to learn at increasing intervals to combat what's called the forgetting curve. And what the forgetting curve is, it's this concept that as you learn something, that information in your memory decays over time. They've thrown out some numbers of 50% of the new information you learn within an hour is gone, and about 90% of that information is gone within a week. Those exact numbers might not necessarily be true, but the concept is that as you learn something, if you're not confronted with it again, you will forget that information over time. And so what Anki does, and what spaced repetition does within Anki, is it confronts you with that same material at different intervals, right when you're likely to forget it, depending where you are on that forgetting curve, which brings your memory back up to 100% because you've learned the material again. And then the next time that your memory decays, it's a slower decline than it was before. And that's really the concept behind Anki, is challenging you with that information right when it thinks you're about to forget it, and doing that at increasingly large intervals to never forget the material that you've learned and put within the Anki software. What this actually looks like in practice with some dermoscopy examples is this is a typical flashcard you would find within the Anki software, and after you've answered it, you can see that the software actually asks you how you felt about answering that question. If you answered correctly, you would likely answer good at the bottom of the screen there, and you can see the different intervals at which it'll show you the card again. If you answered good here, it'll ask you that card again in 1 day. However, if you answered incorrectly, you'll hit again, and it'll ask you that question again in 10 minutes. Now, for example, let's say we answered good on this question. We will be confronted with this card again tomorrow. Let's say it's tomorrow, we see this card again, and this time you can see the intervals have changed. If we answer good again, the interval will now be 7 days instead of 1 day. But if we hit again, it will still show us the card again within a short interval. And if we hit good after that, it will likely graduate to a slightly smaller interval. Because what Anki does is it actually tries to calculate the difficulty of each piece of knowledge and the difficulty to which it integrates into your memory, so that gradually you can spend less time on the material that's easy for you to memorize and more time on the concepts that are difficult to memorize. And this is an example of what that leads to with multiple iterations. This is a card I've seen multiple times now. If I'm to hit good on this card now, I'll see it again in 4 months. And I likely haven't seen it for about 2 months at this point. And so you can see how the intervals get gradually larger and your workload kind of decreases. And so now, why should you use Anki for dermoscopy? Well, it's kind of the perfect thing for Anki, because dermoscopy is pure pattern recognition. It's the identification of subsurface structures and patterns within skin lesions that have been strongly associated with specific types of pathologies. And so being successful in dermoscopy, you need to have rapid visual association of these structures and the pathologies they're associated with, which is purely memorization. which is what Anki is best made for. But more than that, because there's so many structures to memorize and so many pathology associations, if all of these structures and associations have been made into an Anki deck, you will be tested on every single structure and the pathology that it's associated with until you get it all correct. And there's no wires crossed. You're not misattributing a certain pattern for the wrong pathology. But then the spaced repetition of it is really the most powerful thing, because you may be a family practitioner who is not using dermoscopy every single day, and you may not be confronted with every single type of lesion every single day. And so if you aren't confronted with this material regularly, you're likely going to lose that pattern recognition skill that you need to correctly identify these lesions. And so if you use Anki regularly with cards made specifically for learning dermoscopy, and you keep up with those cards, you may keep up that pattern recognition algorithm and always be studied up and ready to identify these lesions, so you can confidently tell your patients whether or not a lesion is benign, whether you think a lesion needs to be followed up, or whether a lesion is definitively possibly malignant and that you need to excise it. And so I'm going to teach you exactly how to do that now. It's a simple 4-step process, and I'll go through the steps one by one. The first step is to watch some lectures, because before memorizing, you need to understand. And thankfully, there's a fantastic resource that's been created for this. Dr. Marghoob, a fantastic dermatologist and dermoscopist, created the 2-step algorithm for understanding dermoscopy and using dermoscopy, and he's created these fantastic lectures that are freely available on YouTube to learn dermoscopy. I've included a link to these videos in the description below. I would recommend that you start by watching these lectures. It's about 3 hours total. It'll be the best 3 hours you ever spend learning dermoscopy. It's truly fantastic, brilliantly organized. And once you've reviewed those, you'll need to go to the Anki website and download the Anki software. It's free on Mac and Windows, and it's free on Android phones. Unfortunately, on iPhone or iPad, iOS, you need to pay about $35 Canadian for the app, but it's nice to support the creators because it's a fantastic app. But anyways, it's freely available at the link I've included in the description. And the third step is going to be to download my dermoscopy Anki deck that I've created based off of Dr. Marghoob's lectures. It has all the same images and the pathology associations that he describes in the videos. And lastly, the 4th step is going to be to review all the cards, study them in the software. But even more importantly than that is to come back to the software every day to do the review cards. And what the review cards are, it's the cards that the software has calculated that you are likely just about to forget unless you study it on that day. And it'll give you a certain amount of review cards that you're supposed to do every day to keep you at the top of the forgetting curve for all the dermatoscopic structures that Dr. Marghoob teaches you and that are included within the deck. And that way you'll be ready for seeing any skin lesions that your patients have in the office. You'll always be ready to use your dermatoscope. Now, further steps, if you're really interested, Anki settings can be optimized to make your review intervals individualized to your specific memorization efficiency, which can decrease the frequency at which you need to do review cards, which can ultimately decrease your daily workload. It's an optional process. It's a little more complicated, but I've included a link to a video that can walk you through how to do that if you're interested. And it can be worth your while if you're using Anki regularly. Now that's it for the process of using Anki to learn dermoscopy. It's quite simple. It does take a little bit of effort and time at first, but as you do the reviews daily, your workload will decrease. And again, you'll find that the algorithm for understanding these structures and their associated pathologies just becomes second nature, and you'll be ready for any dermatoscopic patient encounter. I hope this video was useful to you, and thank you very much for your attention.